Today we're announcing that the University of Louisville and University Medical Center have entered into a long-term partnership with KentuckyOne Health. KentuckyOne will provide to both UMC and the University of Louisville ensure that we can continue to be a leader in medical education, medical research, while providing the very best in clinical care. We first want to thank Governor Beshear for his leadership over the past year in making this partnership a reality.
This is a successful completion of an RFP process that has brought together the University Hospital, the James Graham Brown Cancer Center, and KentuckyOne Health. The University of Louisville and others have worked hard to create a partnership that benefits and protects everybody involved. Others I know today will talk about a lot of the details of this new partnership. But I'm here to tell you that as it is put together and as it is written, these agreements fit within the legal and policy framework that I, along with Attorney General Jack Conway and others, articulated when these issues first came to the forefront more than a year ago. As you know, we had several concerns about any planned partnership with University Hospital, and with this arrangement, the University of Louisville has met each of them to our satisfaction.
I think it sends an important message to our community and to the taxpayers here in the Commonwealth of Kentucky and in Jefferson County that the message that they have been sending, one of transparency, one of due diligence, and making certain that we thought through our path forward, that it was heard and that it was followed. I appreciate the university heeding the guidance laid out in the report that we issued last December when we looked at a proposed merger and decided perhaps we needed a different path. Obviously, the concerns that we cited from a legal and public policy standpoint were followed, and chiefly that the merger did not completely cede control of a state asset.
It's an indigent care hospital. It's a safety net hospital. It provides absolutely mission-critical health care to the entire Louisville area, the region, and even beyond the Commonwealth. So we knew we needed a partner, but what I think was not well recognized is that as UMC's fortunes rise and fall, so rise and fall the fortunes of the U of L Health Science Center. We're completely joined at the hip. And so the importance of this transaction that we're entering into, this partnership with KentuckyOne, assures the longevity and the growth and the sustainability of both UMC as well as the U of L Health Science Center.
Our partnership with KentuckyOne Health will give the clinical and teaching programs at UMC room to expand, strengthening our role both as the community safety net hospital and as a statewide referral center. In addition, UMC will continue to offer a full range of women's health services in our Center for Women and Infants, which will continue to be managed by UMC. That means that there will be no change in the scope, location, or provision of women's care, including reproductive health services and our Level 3 neonatal intensive care unit.
We know all too well the health challenges that Kentucky faces, from a significant shortage of physicians to a high incidence of disease. To meet those challenges head on and to provide quality care for all Kentuckians, Kentucky needs a premier and sustainable integrated health system. We firmly believe that KentuckyOne Health, together with a thriving university medical system and center, will be that system.
This is a special partnership because it will not only enable us to build upon strong clinical and research programs that currently exist with KentuckyOne, such as cardiovascular, transplant, and neuroscience, but will also allow us to develop new programs and to expand our clinical sites across the state. By having these additional training sites, more young people will experience the exciting opportunities available throughout the Commonwealth. and be inspired to practice in those locations.
Our community has the guarantee that we will continue to have every level of health care service that we had before. Important and complex policy issues were worked through here. Everybody understands that. Now, additionally, and from our perspective, which was equally important, we have the guarantee that our city's flagship university will have the resources that it needs to continue to lead in the discovery for new treatments and cures, and have the ability to train the next generation of healthcare providers. The infusion of capital investment from KentuckyOne is enormously important to the future of the University Hospital and the future of our city as well.